Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health. I lead Emory's COVID-19 outbreak response team and am the host for Emory's COVID-19 videos, where we cover important topics about the pandemic. Today, I'm pleased to be joined by my friend and colleague, Dr. Carlos Del Rio, so that we can update you on the most recent information about the Omicron variant BA.2 and the latest information on the second booster. Dr. Del Rio is a distinguished professor of medicine, epidemiology, and global health at Emory, and is the executive associate dean of Emory University School of Medicine at Grady Health System. Welcome, Dr. Del Rio, and thank you for joining me again today.
Delighted to be with you.
Thank you. Quickly, here's a look at where we are with COVID-19 across the United States. For the most part, we've had a really good couple of weeks. Nationally, cases have been falling since reaching record highs in the middle of January. While new cases are still declining, the pace has slowed down in recent days. 15 states have increasing rates of new cases in the past 2 weeks as the BA.2 variant has emerged. Still, most states do continue to see sustained declines, and cases remain at their lowest levels nationally since last July. Hospitalizations also continue to fall, and in the past 2 weeks, hospitalizations have decreased by 39% to around 20,000 cases a day. Fewer than 1,000 deaths are currently being reported each day in the United States, the lowest daily average since before Omicron took hold of the United States on December 1st of 2021. It is worth noting, however, that yesterday the United States passed 80 million cases of COVID-19 and has suffered more than 978,000 deaths associated with COVID-19. So let's begin with BA.2. Just as we were starting to see cases and hospitalizations in the US decline, BA.2 is now gaining significant traction in some parts of the world and is now the dominant strain in the United States. This is the reason we are starting to see increasing numbers of cases in 15 of our states in the United States. So Dr. Del Rio, what is your prediction for what's going on and what we're going to see for the next couple of months?
Well, I think that, as you mentioned, there are three things happening, right? The number one is the emergence of BA.2. BA.2 is about 30 to 40% more transmissible than BA.1 Omicron, which means it is, if you're gonna be around it, is gonna be transmitted. It's highly transmissible. Number two, we're dropping restrictions. People have said enough about masks, and we're not doing. People are going to concerts and they're going to events, and so we're going to see more infections as a result of that. And the third one is that we're seeing a waning of immunity. So those three things combined, I think will lead us to see an increase in number of cases, as we're already seeing, at least right now. 3 states, New York, Connecticut, and Arkansas are seeing a significant increase, but there are many other states, as you mentioned, I think 15 now, that are seeing an increase in cases. Now, would this lead to increase in hospitalizations, severe disease, and death? I hope not, and I tell you why I think that's not the case. The main reason is, the bad news is we had a horrible Omicron surge last winter. The good news is we had a horrible Omicron surge. So a lot of people got infected, and therefore, between people who are vaccinated and people who had previously been infected, the estimates is about 73 to 75% of the US population have some degree of immunity. So the degree of immunity that we have, while not enough to reach herd immunity, is enough to give us a significant protection against a major wave with BA.2.
I think it is very important to talk about how much we suffered from this Omicron surge that we just had, but potentially some good news for us coming out of that, other than families, of course, who've lost loved ones or have had significant time in the hospital. It may afford us some protection for BA.2. And I also think it's the other point you made of it's the layering of this risk and dropping masks that is so incredibly important to think about as BA.2 does take off across the United States.
But the other thing I would say, and I think it's important for people to recognize, is that we also have availability right now of testing, and we have availability right now of treatments. And I would say that the risk equation for me changes dramatically with the availability of treatments like Paxlovid, because if I get infected, I'm vaccinated, I'm boosted. If I get infected, I'll start myself on therapy and I'm going to do fine. So again, the equation, the risk calculation changes dramatically because we have access to therapies that we didn't have back in December.
Very good. Always good news when science moves forward like that. Science also moved forward this week with some more recommendations. The FDA and CDC officially recommended an additional booster for particular people. For those who've received an mRNA series, the recommendation is for a second booster, so a fourth dose, for some who have an immunocompromising condition, and for people over the age of 50 who received an initial booster dose at least 4 months ago. Additionally, in this recommendation, people who received a primary Johnson & Johnson vaccine and have had a booster at least 4 months ago may now also receive a second booster using an mRNA vaccine. So, Dr. Del Rio, officials did not wait for the FDA meeting that's scheduled for April 6th to make this recommendation. Is this a proactive move as we watch BA.2 become the dominant strain in the United States?
Yes, I think so. I think this is, like Wayne Gretzky used to say, this is not skating where the puck is. This is skating where the puck is going to be. We're trying to, for the first time, be proactive and be preventing something from happening as opposed to catching up. Every single wave we've had with this virus, we're catching up. Having said that, I am quite disappointed that this happened because there is a process. There's the VRBPAC at the FDA. There's the ACIP and CDC. We have a process for doing things. VRBPAC should have reviewed the information, should have made a recommendation, and then CDC advisory committee should review the recommendation, pass it over to the CDC director, who then would have signed off on the recommendation. And that didn't happen. And I think, it does undermine the scientific credibility and the scientific independence of both the FDA and the CDC when this happened, quite frankly, because the administration said it's going to happen, because the president said we need to give a fourth dose. And that's totally fine, but we need to follow the science. And there is science to support giving a booster for people who are immunocompromised, and there is science for giving a fourth dose also to people who are over the age of 60. We have some data, for example, coming out of Israel. There's a couple of interesting papers suggesting that when you look at mortality, and again, the outcomes we want to avoid with these vaccines are severe disease and death and hospitalizations. And when you look at death, the study from Israel in people between the ages of 60 and 100 clearly shows that the mortality in those that get COVID and got a fourth dose was much, much lower, that's 50 to 60% lower in those that had only received one booster. So in that population makes a lot of sense. In people 50 to 60, the data is not there. And the reality is when you look at the studies looking at 3 versus 4 doses, it just shows that it looks about the same. You may get a little bit of protection against infection, but that little bit of protection against infection goes away, wanes within 8 to 12 weeks. So this is not the way to. We're not going to be boosting ourselves to prevent infection every time. We need to get the necessary protection to prevent severe disease and death. And for people under the age of 60, there's no benefit in preventing severe disease and death that I've seen by getting a fourth dose. So do I recommend a fourth dose for those under the age of 60? Not necessarily. If they want to get it, that's fine. But my concern is that there's something called immune tolerance. At some point in time, the immune system doesn't like to see antigens that frequently, the same antigen that frequently. And therefore, if you're a healthy 50-year-old and you've been vaccinated, you've been boosted, my advice is you don't need to get a fourth dose. Now, if you're under the age of 60, you've been vaccinated and boosted, and in addition to that, you were infected because you got Omicron and you got Delta, you got the best protection ever. You certainly don't need a boost.
Very good. And that hybrid immunity that you just alluded to, having fully vaccinating series and being boosted and then getting Omicron, which we saw more of the breakthrough infections with Omicron than we've seen with any other variant. It's important to recognize that really does help. And so at that point in time, even if you were over the age of 60, if you've recently had Omicron, would you suggest waiting for this fourth dose?
I would. If you're otherwise healthy, I would. I think that there's really no rush. As a friend said, you don't need to run to your booster. You can walk to your booster. Now, if you are immunocompromised in some sort of way, it's a different story. But if you respond to vaccines, let's say you got your primary doses and then you got boosted, let's say in October, November, and then you got Omicron in January, I think you can wait. I don't see a reason to get a fourth dose right now.
And let's put a fine point on that. For those who have an immunocompromising condition, first of all, who falls into that category? And secondly, this is to make sure that they are receiving the maximum benefit that they can get from the vaccine, as opposed to this is based on waning immunity from the vaccines they've received, correct?
Correct. You know, talking about immunocompromise is a very broad term. And what I'm referring here is to people who are either getting cancer chemotherapy, who are transplant organ recipients, or who are receiving immunosuppressive drugs that essentially impact the immune system. For example, they're receiving a high dose steroids, they're receiving B cell depleting agents, they're receiving those kinds of drugs. I'm not talking about people who say, well, I'm immunocompromised because, somebody said I was. It really is a very specific category of patients. But even then, for example, the most severely immunocompromised, those organ transplant recipients, or those that are getting, some of the B cell depleting agents, those people maybe are not responding to the vaccine at all. So 3, 4, 5 doses, it doesn't really matter. Their B cells are not producing antibodies. For those individuals, we have Evusheld. There's a monoclonal antibody that you can give for prevention as an infusion every 6 months. And those individuals, I much rather send them to Evusheld than to try to get a fourth dose.
And every 6 months at this point in time feels a little bit longer than some of the booster series that we're talking about as well.
Absolutely. And that's why I think, again, if you're somebody, a transplant recipient who got 3 doses, should I get a fourth dose? My advice is talk to your doctor, but you're probably better off getting Evusheld at this point.
As we think about someone who might be weighing the risks and benefits of getting this fourth dose and the timing of it, you already alluded to some of the data that's come out of Israel, a little bit more information. These studies that we've just seen, these are more than 1 million people. But again, they are all over the age of 60 who are included in these studies. And in addition to preventing severe death with this fourth dose that you already talked about, the other data that goes with this is that this fourth dose does reduce the rate of infection by about 2 times and reduces the rate of severe disease about 4 times. This fourth dose is not giving quite the additional level of protection that we saw with the third booster, or the first booster, the third dose, but it is still increasing the prevention that we see. And I think a really important thing as you think about this is preventing infection also helps prevent your chance of getting long COVID. So let's talk for a moment about that and how we should be discussing that the vaccine is helping us keep from getting long COVID conditions as well.
Well, I think the best way to prevent long COVID is to be vaccinated, and the best way to prevent long COVID is not to get COVID. So I still worry about getting infected, even being vaccinated and boosted, and then developing long COVID. And that's why, again, if I get infected right now, I would start myself on therapy because I don't want to get long COVID. I want to get rid of the virus as soon as I can. And treatment also decreases your chance of transmitting to others. I'm not sure a fourth dose is going to afford that for me. It will do it probably, but for a very short period of time. So that's when, the issue comes that people start trying to time their boost. Well, I'm going to go to Europe in the winter, in the summer. Should I get it in May? How should I time it? Because I'm going to want to have the maximum protection. What I tell people is that's a little bit like time to time the stock market. It just doesn't work. And it's better to think about getting if you're going to get a booster, you just make that decision. If you're 4 months, 6 months out, just go ahead and get it. But continue thinking about, again, I still can get infected. I know in the last week, I've heard about, at least a dozen people who have gotten infected, and they're all doing fine. But if you're over the age of 50, my advice is if you get infected, try to get on therapy, try to get diagnosed quickly, try to start on one of the drugs that it's out there for the outpatient management of COVID, because they do make a difference. And I would emphasize to people that the administration just released yesterday, I think, a new website called covid.org that is really fantastic. It helps you find out where to get testing, where to get treatments, et cetera.
I think any sort of information like that, particularly when it's pooled together, is going to be so incredibly helpful. I wish we would have had something like that earlier, but I'm thrilled to see that we have it now. I will admit last fall, I was a little skeptical about getting a booster. I wasn't really positive that I fell into a category that needed it or that the data was super strong that we all needed it. But I have to say, after the incredible Omicron wave that we have endured in the United States and across the world, I'm incredibly grateful to have gotten it. In your opinion, do you think that we're leading to also talking about a booster this fall? That is despite the booster that we're talking about right now.
Well, there's some studies happening right now trying to understand if we need a booster in the fall and what the booster is going to be. Is it going to be the booster with the vaccines we have? Is it going to be an Omicron specific booster? Will Omicron be here to stay because it's so transmissible? Will that be now what COVID is like? And maybe we need an Omicron specific booster. So I think a lot of those studies are happening, and I think they're going to inform decision making, hopefully, for the fall. My thought is that we will probably need a dose then, but again, that's just a sort of a guesstimate right now.
And if anyone were waiting right now and trying to decide if they should get this fourth dose, this second booster, as we talk about an Omicron specific booster, should people be waiting for that right now? Or is this a completely different booster, the need for this booster now that we're talking about, as opposed to an Omicron specific one that might happen closer to the fall or even early winter?
So if you're over the age, my advice is if you're over the age of 60 and you are more than 4 months away from your boost, get a fourth dose now.
Okay.
If you're under the age of 60 and you got your 3 doses, I would wait. I would say, what's the need right now? Let's wait for the fall so we can get a better idea of what exactly is going to happen. Again, when you look at the studies that have looked at 3 versus 4 doses and people are in the age of 60, yes, you get a little bit decrease in the number of infections, but the possibility of severe disease, hospitalization, and death is basically done by 3 doses. 4 doses doesn't add additional benefit.
I think it's important for us to remember how incredibly well our vaccines are actually still working, especially if you've gotten that first boost for the 3 series of the vaccinations for mRNA. They are really still working extremely well.
And that makes me say that the other 2 things. If you've only been vaccinated and you haven't been boosted, you should get boosted because there's clear evidence that 3 doses is way better than 2 doses. And number 2 is if you haven't yet been vaccinated, because my concern is the millions of Americans who've yet to be vaccinated. I'm very concerned about you because it is time to get vaccinated now. And again, if you had COVID in the past, you got some immunity, but get that additional vaccination, get that hybrid immunity, you will be the best protected individuals. In fact, I kind of feel jealous of those that have had COVID and been vaccinated because they have better protection than I do as somebody who's never had COVID before.
And I think there are fewer and fewer of us who've not had COVID yet. So I will second that and say, if you've already had COVID, please find your way to a vaccine or finish your series with a booster. There's also some conversation out on social media and in the science literature about which booster to get right now. A study came out on Monday from the Science Translational Medicine looking at differences in very subtle variations in immune responses induced by Pfizer and Moderna, our 2 mRNA vaccinations, and that they may confer slightly different types of protection. Scientists found that while the 2 different vaccinations have the exact same impact on neutralizing antibodies, they have a slightly different impact on Fc functional antibodies, which target kind of entire surfaces of the spike protein, and additionally differences in natural killer cell activation. I will point out that the authors very clearly state it is not yet clear if these differences actually are meaningfully clinically. But it does raise the question, is there any reason to consider mixing the 4th dose? So if I had had Moderna for my first primary series and for my booster, should I be considering a Pfizer booster, or is there really no reason to try to mix them?
The mix and match study that was done in Emory was one of the sites, shows really no benefit and no risk. I would say, while it may be fun to mix and say, well, I got this, I'm going to get this. The reality is get the booster that it's out there, get the vaccine that you can find, whether it's Pfizer or Moderna. Your immune system really doesn't know that difference. It doesn't look at the vaccine. You know, this is so new to me. This is so different. I've never had anybody go to the drugstore and say, you know, I want to get the flu shot, but I want to get the Pfizer one, or I'm going to get the Sanofi one. You know, you just go and get your flu shot. And
Right.
you need to think about it that way. If the FDA has approved the drug, the vaccine is a good vaccine. The science translational study, what created a lot of buzz in social media, is it showed that the mRNA vaccine produced by Moderna produce a more specific IgA response. And the IgA response obviously is the kind of response you need at the mucosal level. So it theoretically talked about a better protection against infection. Again, when we looked at the data, we don't see major differences between having been boosted with Pfizer or Moderna. We see a little bit of a longer, a lower decrease in the waning of immunity with Moderna, but that may have to do with the antigen. The dose in the antigen in Moderna is a little bit higher than in Pfizer. So also the issue with Moderna is you got a little bit more of sort of, you know, toxicity. You get more fever, you get more adverse events. So, but at the end of the day, I think these are minutiae that, quite frankly, I don't think it's worth worrying about.
Very good. I will say I was intending to stick with my original series of mRNA vaccines for my booster, but that is not what I found available in the fall. And so I received the mRNA booster that I did have available to me at the time. So I ended up mixing, although that was not originally my intent. Dr. Del Rio.
But you got boosted, and that's the important thing.
Exactly. Exactly. And I think that that's exactly what we want to get across today for anyone watching who's over the age of 60 and at least 4 months from their original booster. Dr. Del Rio, it is always a pleasure to talk COVID-19 with you and the latest information that we have available, both on BA.2 and the need for a fourth dose of a vaccine for those over the age of 60, those with very specific issues that cause immunocompromising conditions. And for the rest of us, there is time to consider how to get your way to a vaccine. But if you've not yet received any vaccine for COVID-19, we both urge you to please find your way to a vaccination. If you have started the series and have not been boosted, we urge you to get the booster as well. Dr. Del Rio, thank you so much for joining me today.
Delighted to be with you.